All right. So, first of all, Assalamu alaikum and a very warm welcome to all of you attending today. My name is Aisha Seher and I'm a fourth year medical student and a National Head Education Department, Singh, Pakistan. It's an honor to be your host for this informative session. We are here to delve into ANC clinical examination, a crucial milestone for those aspiring to practice medicine in Australia. Before we proceed, I would like to introduce you to Synch Pakistan, the wonderful organization behind today's event. Synch stands for Solidarity Among Young Nations for Change. It's primarily made up of medical students and has grown to include over 60 medical colleges throughout Pakistan. Synch also includes over 10,000 medical students and is actively recruiting students and professionals from various fields with a mission to positively impact lives through education, awareness, and support. Synch works in areas of health. Synch works in areas of health, education, training and development, medical research, and welfare. To begin our session on a spiritual note, we'd like to start with Tilawat Quran for the beautiful recitation. We are privileged to have Dr. Rizwan Qureshi with us. Dr. Qureshi is highly esteemed consultant emergency physician at Wollongong and Liverpool Hospital, director at emergencyfocus.net, and conjoint lecturer at University of New South Wales. His extensive experience and expertise will provide invaluable insights into the AMC clinical examination. We are glad to have you on board, Dr. Qureshi.
Thank you very much. It's a pleasure to be here, Dr. Aisha.
All right, over to you now.
All right. Okay. Thank you very much. So look, there are close to about 100 people. And I think some of the people, in my understanding, are joining us live from Facebook. So that's an excellent turnover. I'm sorry for the people who could not join us on Zoom because of the limitation of 100 people maxing out. But then again, we'll make the best of it across both worlds. I think there would be someone, I believe, Dr. Aisha, who's moderating the comments on both here as well as in Facebook. Is that right?
Yeah, exactly. I'll be moderating.
Wonderful. Excellent. So look, I will keep it very simple. As you know that I have got a very great deal of passion when it comes to medical training, because there's a lot of confusion around what medical training is and what are the avenues and opportunities for medical training. So this session is all going to be about medical training for junior doctors as well as medical students who are thinking about Australia. I'm not going to be talking about USMLE or UK. I'm just going to focus on Australia because I think this is a newly emerging market with lots of opportunities. And before this talk, when I had the opportunity of, trying to elaborate on what the discussion should be like, I was thinking about what should I talk about? Like, how can I have a better reach and better depth of reach? And I've divided this sort of discussion into key points. So I'm going to talk about the opportunities. What do I exactly mean by that? Better training opportunities. I'm also going to talk about why Australia is such a better destination compared to other countries at this stage. What do I mean by various things like work-life balance and the quality of training and quality of life and, down the line when you've got families and all. And the most important of all, I'd like to have questions. So let me start. In the last 2 years, between 2022 and 2024, as of last month, there have been about 11,209 international medical graduates who've started their career in Australia. That's about on an average 5,500 doctors who have not graduated in Australia, but coming from countries like Pakistan, India, Middle Eastern countries, and other countries, UK even. So there's a lot of trend moving across in all grades. So junior doctors, middle grade, and higher grade. So a lot of opportunities, both in terms of training or coming as a GP or coming as a specialist. Not only that, there have been about 31,000 nurses as well who have joined Australia in the same duration of time. Now, I'm yet to see many nurses from Pakistan. I don't know why, but I do see a lot of nurses coming from Sri Lanka and India in particular. So I think this is something which would be important to reflect on that one. There have been about 11,000 allied health. Now, those of you who don't know what allied health are, allied health are like speech therapists, physiotherapists, occupational therapists, and other allied healthcare. So a lot of opportunity when it comes to the medical profession, not only doctors, the nurses, and as I said, allied health as well. So what do I mean by better training opportunities? I've made some notes about to, keep my thoughts as simple as I can. By better training opportunities, I mean every specialty is a fair go. And I get a lot of questions that, look, I'm a basic MBBS. I've done no research. I've done nothing which would stand my CV out. And how do I start? And can I get into cardiology or orthopedics or plastics or dermatology or neurosurgery? And I said, of course, it's not a question for me. It's a question for yourself. Are you willing to do the hard yard? Are you here to put in the effort which is required to get to your goal? So every specialty is a fair go. Obviously, some specialties that I've just alluded to are going to be more competitive than the others. The ones which are very common and in big demand, and I see a good growth in them, are my specialty, emergency medicine. As you know, that I work as a consultant in emergency medicine, and we've got always an opportunity for people who are wanting to specialize in emergency medicine, acute medicine, or internal medicine. Now, those of you who are interested in internal medicine or want to go to USMLE, you know that majority, more than 2/3, or I think about the last number was about 63 to 65% would join internal medicine training programs. So internal medicine in Australia is also big. A lot of ramifications in terms of acute medicine, geriatrics from that point of view onwards. Intensive care medicine, again, a very good specialties. There are a lot of intensivists who are coming from India, not many from Pakistan, but again, good demand. So who have got interest in this newly emerging field. There's been College of Intensive Care Medicine, which has been recently established in the last 10 years, and it's now a very bustling college from international medical graduates. Also, geriatrics, psychiatry, pediatrics, ONG, radiology. And I have seen IMGs working here in cardiology, now working as a consultant cardiologist. I've seen IMGs working or training in anesthesia, general surgery, orthopedics, neurosurgery, respiratory medicine, endocrinology, and even ophthalmology. So the point that I'm trying to take is there are better training opportunities in every field, provided you're up for it. If you're not up for it, there's some easy specialties to get into, as I've said, in the hospital sector, which I've just alluded to, and obviously in a general practice if you don't want to go and play that hard yard. Now, what makes you eligible to get into any training? Simple. You have to have a journal registration. And for most specialties now, you have to have a permanent residency. And we'll talk a little bit more about what do I mean. But essentially, journal registration means that you've done AMC 1 and AMC 2 or have completed the WBA program. Now, those of you know, I talk a lot about these things. What is the WBA program? What is the AMC clinical and AMC MCQ all about? And there's multiple videos on my emergency focus YouTube channel, so you can orient yourself, or you can ask a question at the end. After completion of 12 months of supervised training, you get a general registration, or what we call a full registration as well. And as soon as you get the full registration, the third perk, you can apply straight away for a permanent residency. Now, Australian permanent residency is perhaps the fastest when it comes to any other country. If you compare it to the US, I was talking to one of my friends, he was saying it'll take about 10 plus years to get a green card. In the UK, the situation is not so different either. But in Australia, once you get your general registration, the day that you get your general registration, you can apply for a permanent residency through your own application. You don't need any sponsorship. You can apply it on your own. Now, once you get your general registration and permanent residency, you can apply for training program. Having said that, some of the programs can give you a provisional training entry, like emergency, psychiatry, geriatrics, internal medicine, because they need doctors. They say, fine, come join our program and we'll get you on board. And once you get your permanent residency, just update your documents. So there's a good opportunity from that point of view. Now, I'd like to talk about quickly is people often say that what makes our CV ideal about entering into any training specialty. So your experience starts from Australia. So let's talk about the Australian, and then we'll talk about what can you do as a medical student or a junior doctor back at home to highlight what you need to have done. So experience in Australia, meaning clinical experience. So work in combination of urban, like city hospitals, like regional hospitals, or semi-urban or rural or regional hospital, everything makes a huge difference. The other thing, references count a lot. Now, gone are the days when you have those pre-made letter of support or letter of references. It's all structured. So whenever somebody wants to give you a job, they send out a reference, and that reference is online. So you don't get to see the reference at all. But those references, I've done a video on that topic as well, are in the way of your professionalism. Are you punctual? Are you professional in your conduct with your colleagues and your patients? Are you collegiate? Have you got good communication skills? Have you got good clinical procedural skills? So those references do carry a lot of weightage. If I'm impressed by any IMGs and he puts me down at a reference, I wouldn't even mind giving a call or good glaring references so that he gets onto the training program. The other thing is teaching. Now, I see a lot of CVs now for the junior medical officer, and they often put in their CVs, oh, I've done teaching. Doesn't mean anything. It has to be put in structured way, that I've been teaching the younger medical students year 1, year 2, even if you've been teaching sort of in a private capacity or doing some sort of teaching, even though it might not be medical student, might be something else. You need to have a structured and organized way of explaining that on your CV. It's unfortunate that we don't have that much experience when it comes to drafting the CV, which is a topic for another day. But that is one of the things which your CV gets matched again, even at a junior doctor level. Now, it's hard to imagine with the growing medical migration, especially in the US, that you would get entry into any training program without publications. That's why you've got these budding publications and researchers, because everybody wants to have like 3, 4, or 10 plus publications to be eligible for a training residency scheme. So you may not have requirement for clinical experience, but there is a requirement for research experience in the US before being accepted into any training program. In the UK, it's hard to get into any position if you have got no medical experience, if you haven't got good clinical experience back home in your own country. You won't just get shortlisted. And that's why we're dealing with massive exodus of doctors from the UK, because they're no longer able to get into the right jobs, given the fact that they've got little experience or they haven't got any experience after their graduation. So it is all coming down to your clinical experience. Gone are the days that you had your PLAB 1 and PLAB 2 or AMC 1 and AMC 2, and you'd be like, fine, I'm good to go. Australia, here I come. It doesn't work that way. Never did and never will. I mean, you will come over here in Australia if you're a spouse or, your partner is already here, and you'll waste time. You'll basically sit here, you'll waste a lot of money, you'll do a lot of courses and clinical observership. Eventually, you do have to go back to Pakistan or India or any other country to do recency. So why not utilize your time when you're in Pakistan to do the publication, do the teaching, do the references, and do the clinical experience? It is no longer about, will AMC 1 get me the job? Please get this thing out of your mind. There is no such thing, AMC 1 exam getting you the job. No, sir. It does not work that way. AMC 1 will never get you a job. It's just a licensing exam, just like PLAB. It's got nothing to do with the job. So please do not ask me these questions. What are my chances? I've only done AMC 1. You need to have something extra. Otherwise, if you want to become a sheep in the market, there are plenty of sheep already. There are probably about $5,000, $6,000 doctors already here who haven't got a job. But why do the doctors from India and Pakistan directly get hired, offered a visa? Because they've got good clinical experience. And I've been telling this thing to all, and I've been mentoring about that to everyone. Have a clinical experience, avoid clinical gaps, and work your CV up. Anyway, these are the things which you do require back home in your Pakistan. But once you're in Australia and you get your first job, you need to work on publication. You need to work on teaching the medical students here. You also need to do courses which are relevant to your specialty. So in summary, your clinical experience here in Australia, at least 12 to 24 months in the specialties which will get you closer. Say, for instance, you want to become a cardiologist, you need to complete a basic physician's training. You also need to do some unaccredited years in cardiology. You need to have some publications. You need to have a good references from a cardiologist. And then, as I said, some teaching experience on your CV. And this, yes, why not? You will get shortlisted in cardiology training program. Okay, so that's something that you can do in Australia. You don't have to do in Pakistan, but at least you should have those germs in Pakistan in your CV to start that process. You cannot have, a moment of realization and come everything's falling in your lap. Oh, when I come to Australia, I'll do that. No, sir. You have to start working in Pakistan on those lines, working on good clinical experience, avoiding the clinical gaps, working on publications, having an understanding at least, and doing the courses. Any course is fine. You need to create your own distinction into your CV. Now, look, once you're doing the training, prioritize a good training. There's a lot of confusion around what constitutes a good training, in which you get direct supervision. There's someone who is critiquing you, who is guiding you that, look, this is the way that you see the patients. This is the way that you do the procedures. This is the way that you communicate. If somebody is not there with you at your job, you're not getting a training. And it does not have to be a training position. It could be just a small private hospital, but you at least got a senior who's taking your hand and taking you through. But most of this comes on your own press, your own inquisition. If you're keen, people will be keen to teach. If you're not keen and you're expecting that people will come and teach you, it does not work that way. Not in a postgraduate world. So gone are the days of spoon feeding when you're, just MBBS and under. Now you have to take initiatives. And earlier you learn to take initiatives, the better it will be for you. Now, we've talked about the permanent residency, work-life balance. You probably don't realize it right now because you're young, you're full of energy, but you will begin to realize that, look, what do I mean by work-life balance? I graduated, as some of you may know, from Dow Medical College back in 2001. It's been about close to 23 years that I have been obviously training and working as a consultant now for about 10 years. You must enjoy your training. What I mean by enjoyment is that you're learning every day. You're being mentored every day. You're being tutored every day. Okay. And that's based on your own interaction. Plus, you should experience, you should work in multitude of hospitals, not stay idle, work in different departments. So construct your training in a way that is taking you places. And that is a positive learning. You should also have, the capacity to earn better. As most of the people who, including myself, when we came from Pakistan, we need to earn and support our families. We need to also support our parents in some instances. And, that's a fair thing. Most of the doctors who are working in Australia, don't you think that they're supporting their own families? They are. So you should be able to earn better to support your own household, back support your parents, elderly parents, or your brother and sister, whatever it is. Plus, you should travel. I would always say that, look, travel is one of those things which really opens up your horizons. And during your training, if you get your annual leave, don't just think about that I can come back to Pakistan and that's my annual pilgrimage. You should travel to other countries. You should go and visit other hospitals, see other places, enjoy yourself. That is a part of your work-life balance and, good mental development. And uh, I cannot emphasize this enough, that this balance would provide you with a plenty of opportunity to grow, meeting new people and developing new experiences. Now, I'll briefly touch down on the question that I get asked, which sends me into a bit of a wary way that, if I've passed the AMC1, what are my chances of getting a job? Your chances are great. If you pass your AMC1, plus you do everything which is required from an international medical graduate to get their first job. And the first job is not into a specialist training. It is just a rotation. It's for 1 year. It will be called Journal RMO rotation, medical training, which would have a combination of medical, surgical, ED, ICU, anesthesia, all of those combinations. So the first job is your target. You keep it simple. And in order to achieve that target, you have to have not only completed your internship, but at least do your basic RMO year. At least be in some hospital doing a medical resident officer position. And there are various criteria where your medical resident officer position is judged. Now, let me tell you something. I was like at the conference recently, at the international conference, and I met one of the leading recruiters who was a consultant in emergency medicine, but he was also the director of one of the hospital. And he said, Rizwan, we are seeing these CVs from Pakistan and from India, and they look good on paper. But the hospitals, when we search them, they are small medical centers, they are small clinics. I don't know what they're putting on the CV really justifies that. So, this is the concern which has been raised. So if you're working in small medical centers and small hospital, and I can understand this is not dependent on you, the job market is pretty tough, but try develop an understanding of how the work is. Now, when I did my MBBS and after my house job in Civil Hospital Karachi, I worked in OMI Hospital in Karachi. I'm not sure if it's still there, but it's a good small private setup. There are other good small private setup, and you can always find a job in Ziauddin Hospital or in other city hospitals in Lahore. There are good private setups that you can come and be engaged. So try make it a habit that rather than finding a hospital which is closer to your home and you don't want to really put your effort in because you want to prepare for an exam, no sir, exams are on the side. First of all is your clinical experience. Emphasize of working in a good private setup. If you get into a good medical or government setup, that's fine. They learn by volume. Or even if you're working in small setup, make sure that you're under a mentorship of something or someone senior. Go and visit your hospital. I still remember when we finished our house job, me and my friend went out and drop our CV at every hospital that, look, I'm available. In one day, we dropped our CV to about 10 or 12 hospitals. And we said that, look, we are interested. And we got calls from pretty much everyone. And I ended up choosing my hospital because it's clean, it's big. So it does matter where you're working, and it is up to you to improve your chances. At the end of the day, you'd be all competing amongst your each other self. So having a good experience in your CV by good private setup or a good government setup is obviously going to add better stars and better shortlistable criteria on your CV. As I said, you're working on your references when you're doing a job. You're working on your teaching. You're also teaching the juniors, and you're also getting a learning experience. Plus, if you can get a publication, why not? Why not? At least it'll give you some sort of introduction of how the research is conducted. It does not have to be published. It can be presented. If you've got some idea on audit, you can present that audit onto your CV as well. So there's a lot going on in those 6 months, 8 months of a small RMO job that you might not think of as much, but it is actually structured in a way that it can extract a lot of experience to make your CV eligible for getting a job better than the rest of your peers. Now let's talk about, I think I was asked to talk about the AMC exam. Most of you would know AMC exams, both 1 and 2, are quite similar to PLAB 1 and 2. AMC 1 exam is unfortunately right now not being done in Pakistan. So people have to go either to Turkey or to Malaysia. They go to Thailand to do the exam. There are strong considerations now by Australian Medical Council to have a center open in Pakistan. I don't know the date, but it looks like perhaps sometime in the future, it might be opening up at Pearson centers. It's a computer adaptive test. It's an MCQ exam, which is based on medicine, surgery, pediatrics, mental health, obs and gynaes, population health. And it's got a good pass percentage. You need to prepare for it. There are certain resources. You have to have gone through AMC Handbook of MCQ. Anthology of Medical Condition is another book. Murta's General Practice is a good reference guide. And obviously, Oxford Handbook of Clinical Medicine, which you may have all studied from in your final year or during a house job, is also a good aid. In fact, I relied on this book, Oxford Handbook of Clinical Medicine, for passing my PLAB as well as my AMC. And also people use Kaplan USMLE Step 2 notes. On top of that, you can get the online resources, which includes guidelines. Some of the guidelines are actually free, like Royal Melbourne Hospital and Children's Hospital for pediatric guidelines. You can also get up-to-date guidelines, therapeutic guidelines in Australia. There's MBOS MCQ practice tests. There's Canada QBank, and there's also MX MCQ practice tests, which are available. Or we've got an MCQ course, which the next one is starting in September. It's quite popular. And it's one of the leading MCQ course for AMC, and you can register for that as well, because half of the things that I've just talked about, we do provide with that. And we've got a portal with all the notes and MCQs and a trial exam. A lot of it's got to do with an organized study plan over at least 4 months. So you should dedicate 4 months with your full-time work, that is, to study. And at the end, you may have to consider like about 1 week to 2 week of study leave to focus and do lots of MCQs and go and attempt that. The part 2 exam has been now rationalized. Initially, the passing criteria was 10 out of 14 station. It's now been reduced to 9. We've had a very good success rate from our last course batch. I've been receiving messages, so thank you for all the hard work with the tutors. So 9 stations out of 14 constitutes a pass now. And it's a clinical scenario. It's a lot about communication. And I hold to this day, they are, it's a practical exam. It's an exam which is based on speaking, and it's exam based on interaction of patients, role playing, quite similar to PLAB 2. And then it is timed, obviously. So 2 minutes of reading time and 8 minutes of performance time. And it is easy if you practice lots and lots of cases. Again, the domains of cases are same: medicine, surgery, pediatrics, and mental health, obs and gynae. And people often ask me that, look, AMC, is it like USMLE? No, it's not USMLE. It's all based on your final year subject. So if you do your final year well, then AMC is fair go. People often also ask me, what is the eligibility to sit for AMC? Basically, you need to have completed your MBBS. You don't have to have it your house job done or registered with Pakistan Medical and Dental Council or any of the Indian Medical Council if you're coming from that part of the world, but at least have MBBS degree, because that is something that you have to get verified from EPIC to form an eligibility criteria. And obviously, needless to say that your medical college or medical school should be on the list of the colleges which is approved. And most of the colleges, by the way, are. There are very few colleges which are not approved, or medical schools which are not approved. So MBBS degree, you must have it in hand to apply for AMC, not the house job certificate, not anything else, but the MBBS degree. Now, previously, I used to say that, look, there are poor opportunities for interns. Last year, there were about 124 international medical graduates who got intern position. And 126 applied for it. So I think 2 got left out. That does not mean that they may not have done the internship in their home country. They would have done internship. They may have done partial internship, but there are now opportunities to do internship in as well. I am repeating again, please don't ask me this question, that shall I just leave the internship and just focus on AMC? No, sir. Your primary responsibility is to complete the AMC MCQ, internship, and then prepare for AMC MCQ in that duration of time, and prepare for AMC clinical for that matter as well in that duration of time. It's almost negligent of you to drop out your internship. I still remember one of my friends who was thinking about the USMLE thing. I'm not going to do the internship and all that. He, for some reason, could not go to the US. His scores were not very good, and he did not get matched anywhere. And then he did not do the internship. In fact, he did do the internship. He left the internship at 6-month mark, and then his whole life suffered. And the evidence says that if you are doing the internship and keeping yourself involved in resident medical officer job and junior grade jobs, you will land into training. Majority, more than 76% of you who are keeping least amount of gaps in the clinical career will get onto the training program. That's evidence. That's a published evidence. And most of you who are keeping the continuation of clinical experience will land themselves into a training program, either in Pakistan, Australia, UK, US, whatever it is. But those of you who are peppering their CV with gap here, gap there, marriage here, kid there, nobody's interested in your personal problems. Okay, this is a medical competitive job market. You're getting paid top dollar. You're getting paid in most countries. They're not going to accept you just because you had some personal reasons of having a gap. So make sure you avoid the gaps. Make sure you continue on with your training as much as you can across the private and public hospitals. Make sure you pass your exam by doing the due diligence and due preparation. Do the courses, training, teaching, and research, and you would be fine with that. It's just a matter of fact, when you get lazy and you think that passing the AMC or AMC MCQ would get you the next step, AMC MCQ never gets anybody a job. This is a misunderstanding. Same as PLAB will never get you a job. Same as USMLE will never get you a job. I want to be very clear on this. And look, there are huge advantages when you follow the procedure correctly. When you do your exams, when you do your training, when you do and progress on, you will get better opportunities. Same as that. But if you're not disciplined and organized, there is going to be consequences. And unfortunately, these consequences are going to be your problem, nobody else's problem. There are people, as I said, that there are 11,209 doctors who came and registered in Australia, all of them IMGs in the last 2 years. So there's great opportunity. And I think it will continue on looking like that because of the expansion in medical roles. But you have to create the best circumstances for you. And I'm just giving you a roadmap for best circumstances. So if I was to give you a pathway, do your AMC1 during your house job in your country, as I said, make sure there are no clinical gaps, continue on with your internship and medical experience as a resident medical officer job, being under the direct mentorship of anyone. Work on your CV and application. You should have your CV and application and cover letter go through at least 5 drafts before you're ready for an Australian market. Unfortunately, we don't get any teaching training or anything like that whilst we are in here. But this is the time to look into those things because these are the things which will land your first shortlisting. And there's a famous rule which I often say, it's 100, 10, and 1 rule. You apply for 100 jobs to be shortlisted for 10 and finally have 1 job offer. So if you stay to that mantra, your approach would be a lot more clear. Obviously, you may get shortlisted on 10 jobs, the first job. It doesn't mean, but I'm just giving you a ballpark figure that that's how you should be approaching the whole situation. I would like to take questions. So if you've got any questions, I'm open for that. And we'll take it from there.
All right, thank you so much, Dr. Rizwan. It was such a nice session and such a detailed session. I personally learned a lot. Now we'll be moving towards questions. The question which is asked most in the chat box is like we have a lot of people who are like right now in their doing their MBBS, like in fourth year or final year. So they are asking like if we go for electives in Pakistan, like Al Khan, Shifa, and Shukut Khanam, these 3 are the institutes which offer electives, in surgery and medicine in Pakistan. So should we go for that? And does their letter of recommendation matters for our CV or not?
Okay. So first thing, letter of recommendation, throw them to your bin. They don't mean anything. Never will and never will. Never did, never will. Sorry. You will have structured references. These are online links which are sent to your references, and you can make a letter of, for a record, for a memory, picture it, frame it, but that's all what it's worth of. Electives, observerships, 100%. In fact, that's the point which I've written in somewhere here. Do electives. When I was applying for the UK, applied for electives in Shaukat Khanam Memorial Cancer Memorial Hospital. I applied for electives in Khan. I did apply for electives in SIOT. Obviously, I had to move before doing any of those electives, but I know some of the doctors who did the electives for 2 weeks. It does not have to be a whole, 4 weeks sabbatical. You can do 2 weeks, 3 weeks, but do dedicated. That elective may generate a reference for you. It could be a professor that you've really impressed with your communication skills. You've really learned something from them. It is the most prestigious and most important building block of your time. So definitely do an elective. Invest in yourself. If you're in Karachi, go and do elective in Lahore. If you're in Lahore, come and do elective in Karachi or somewhere else. It does not really matter if you're doing an elective in a small hospital. In Australia, most of the medical students would go to Bangladesh, or they would go to India or some African countries to do an elective, and they would travel. So why can't we do the same? We can do exactly the same thing. It opens up your mind and creates another dimension of learning in resource poor, smaller hospital where you're seeing lots of diseases. And I think I would like to also make one other point, Aisha, is that we don't write enough. Develop a habit of journaling. Write every day that you see something interesting. If you've seen an interesting case, if you've seen some stressful situation that has affected you, trust me, these reflections, these documentation in your journals will go a long way. And if you've got no time, you can just create a small voice note for yourself to write it down later. Because in an interview, you can give them a live example that this is exactly one of the situation which was precisely I was involved in when I saw a neonatal resuscitation. That was a very moving experience, which not only highlighted a clinical aspect of management, but also some of the communication challenges the doctor faced. So much individual value to be had. So much, I cannot emphasize enough. So definitely do electives whilst you're waiting for the RMO job. But as I said, fundamental thing is internship, RMO, pepper it with your electives. That is going to go gold.
All right, thank you so much, sir. There's another question, does medical or surgical portfolio, like creating that portfolio adds to your CV? Yes or no? And if we, if it adds, then how to create such portfolios, because we are new to it, so.
So I don't know what you mean by portfolio. I just said what things do matter. I mean, I remember when I was in the UK, they gave us portfolios. That those portfolios were like going through your respective rotations. I did my foundation year 2 there, and reflecting on what you're learning, plus having the meetings with your supervisor, having the 360-degree assessment in those training position, plus a reflective learning of some of the interesting cases that you've seen, plus any exams and courses that you've passed, plus, you know, why these exams and courses were important for you for your particular trajectory of specialization. So if you mean by that portfolio, yes, definitely build up a portfolio. It's actually a documented way of progressing through your career that, look, I want to be a surgical or orthopedic doctor. I've been doing on orthopedic RMO work in one of the leading private hospitals, and I've seen this many operations. I've scrubbed in this many operations. I've seen some of the rare diseases that goes in your portfolio. I've done some of the workshops for basic skills. Now, one of the thing which we often get confused is that medical students or junior doctors think, oh, I need to do AO courses if I'm thinking about ortho, if I need to work about my transpedicular screw fixation for spine surgeries. No, no, no. You need to do basic things. You are going to get hired, as I said, as a resident medical officer who is good at following instruction, good at communication, and has done most of the things in terms of taking orders, documentation, and communicating with the medical as well as non-medical people. So it does not require you to do very complicated courses. Basic life support, advanced life support, pediatric life support does not really even matter if you thinking about the surgical thing. You can do any course, communication skills, procedure, whatever it is, for your progression of the career in any specialty. And then once you come to Australia, yes, you can be a bit more specific. Right now, you need to have the best possible CV or portfolio to keep it as general as possible, because the first job is more like, oh, I need that first job. Once you get your first job in Australia, the second job could be more career oriented. First job is obviously the country and migration oriented, and the second job is more towards the career orientation.
All right. So thank you so much, sir, for answering the question. Now there's another question. People say that they have seen medical graduates, like after they do their house job, they go to Australia, do some observership there, okay, and then they go for AMC step 1. So the thing is, is it like this path more better than, like, directly going for AMC 1? So in short, like what I'm trying to say is, doing observerships in Australia, like we just discussed, like we do in Pakistan, does that matter or not?
Absolutely, 100% it does. Look, when I was in the UK, I did 4 clinical observership before being shortlisted for my first job. In Australia, yes, definitely do clinical observership. Now, the hospitals are very strict in terms of offering but there are observership programs. There are GP practices that you can go and do observership. It's only orientating yourself about the clinical system, the communication the doctors are having with their patients. So definitely, observerships are worth it. Now, in terms of where to time it, don't come to Australia for observership. Do your AMC 1 in your own home country. It is an expensive route. You don't want to stay in Australia for AMC 1, do the observership. If you don't pass, and you're in a vicious circle. So at least pass AMC 1. You know, AMC 1, the beauty of AMC 1 is never expires. All right. You can do it from the comfort of your own country or nearby country, and then you can come to Australia, do the clinical observership, do the courses over here. But try be economical in your approach. Try spend less to have a better yield. So if you can do your AMC1, which makes you eligible for a job, whilst you're working in a job in your home country, that is the best chance of you getting shortlisted. 90% of the doctors who are shortlisted for a job here in Australia, their first job, are actually working as resident medical officer back home in their own country. 90%. And I'm not joking. And I want you to, everybody to understand this. You need to be working in a job to have a job. Now, you can take an annual leave. You can come and do clinical observership. That's completely fine. The more decorated your CV is with electives and observership with the courses, the better it is. But please, as I said, gaps are to be avoided like a plague. Like a plague. There is no worse thing for your CV than a gap. And when I say gap, anything more than 3 months is no deal, because there's such a good quality candidates now coming in with 3 or 4 years of experience, the middle grade, they've done membership or MD exams from India. You won't stand a chance before them. So why not, people like when we are having consultant women, we like to give junior doctors a chance. Everybody likes to take a mentee who is junior, who can be molded. Okay, nobody likes to see a senior doctor coming into a junior role. They would like to see young doctors who are fresh medical graduates who are working in an RMO capacity to be molded into a more Australian system. But as I said, avoid gaps. And yes, do clinical observership, do medical electives. That's how you decorate your CV. And you can easily, if you've got resources, yes, definitely come over here. But do not waste your time by staying in Australia and just doing clinical observership in the name of CPD, in the name of, we just applying for jobs. And no, sir. You need to value your time. As I said, 3 years after your MBBS, including the house job, are the most precious year of your life. And I know a lot of you are, I'm not sure, like might be girls, they might be getting married in these 3 years, but you need to prioritize your own standards. Because if you don't, nobody, as I said, is responsible for your future apart from you. Okay?
Yes, thank you so much, sir. Now there's another question which is being asked over and over again, that if we spare time to give MRCP and MRCEM exams, does that consider a clinical gap or not?
Yes, it's a clinical gap. There is no, even if you're sitting for AMC exam and you've got a gap, it's a gap. So there is no concept of taking 3 months, 6 months for an exam break. I learned it the hard way. Okay. So when I moved to the UK, I did my house job and RMO job, and then came to the UK. And then I had been sitting there doing clinical observership. It took me a long time to get my first job because I was not working. The people who were junior to me, who were coming and getting the jobs because they were working as a resident medical officer. Exams are your own problem. Exams got nothing to do with the job, and they need to be done in your own time. They are a necessity. They are necessary because obviously AMC is a licensing exam. Before that, you won't get registration. Membership exams obviously don't count in Australia. So you can do them for showing an interest in particular way, but it does not mean a lot here in Australia. So if you're thinking about Australia, membership are, look, honestly, you can do them for your own learning, but doesn't really add much value. But as I said, exams need to be done in your time. Any study leave, extended study leave for more than 3 months, it's you're creating problems for you.
All right. So there's another question from India. So there's this, I guess, postgraduate resident. He says that if he does his job like in India for at good hospital for like I guess 3 years, and after that, if he applies for a job at Australia, so like, would there be any chance of getting good salary or stuff, or like it's like the same pathway for everybody who's like initially starting their job there?
The salary for the resident medical officer, I've done a great video on that. It's on my Emergency Focus YouTube channel. You can have a look at that. But you're paid very well. Your starting salary is between $80,000 and $110,000, Australian dollars, that is. So you're paid well. If you've got enough experience, a 3 year plus, you might be taken Once you apply for registration, you might be hired as an SRMO, which may add another $10,000 on your initial contract. So yes, definitely, if you're coming at a senior level, it may add further seniority level pay salary, because you're paid per hour, and then you work minimum 40 hours. So your per hourly rate would be obviously better as an SRMO compared to RMO level 1. And yes, so that, and plus registrar. So yes, it does help that if you've got more years under your belt back home in your own country, you might be level 2 supervision as opposed to level 1 supervision. Level 1 supervision, that you have to run every case through your consultant, and it's a junior grade, and you will be RMO 1. But if you're level 2 supervision, you may be starting as SRMO or a registrar, which is a good, and the salary is good as well, but not a huge degree. Again, your salary would be landing between 80 and 110, $120,000 Australian dollars per annum.
All right. So, sir, like I saw your video on your YouTube channel as well, and you just mentioned, like right in the session as well, that ETLS and basic life support courses matter a lot in CV. Like if we go for those courses and add that part in our CV, it's a good omen or a good thing. So, how to get those courses? Like for me as a fourth year medical student, it's quite difficult to understand like from where like I'll be doing those courses. Like there are some societies, local societies offering sources in our university. Apart from that, I don't know like any source like where I can register or stuff. So can you guide on that?
Look, I know CPSP organizes courses. They do advanced cardiac life support and basic life support. There might be other hospitals who might be doing basic life support. It would be your own research into these courses. The courses are important. They're not a deal breaker, but obviously, when you've got 10 CVs for a single job, and you know, 4 of them have done courses, clinical observership, have got no gaps in their CV, and their CV is well done, obviously, those will be given a preference. So research into it. People, when they're going to US, they do researches. They start going into uncharted territories. They would do researches in molecular genetics. Do you know how that research comes about? But they invent themselves. They go and look and seek for the right pathway. So not being able to find a course is just a bit lame. You need to find your own resources and courses. It doesn't really matter at the end of the day where you're doing the course. It matters that you need to have a course. You would be duplicating those courses once you come to Australia, but at least having that security and sensibility that I've done a course is good. Now, there's very interesting question, which I do get asked a lot. Hello, doctor, I know it's hard to answer. Could you please put some light regarding average time to find a job after AMC2 these days? This is a wrong question and a very wrong concept. There is no such thing as average time. There are people who good CV who would have passed the AMC2 and they'll get job. There are people with excellent CV who do not even need AMC2 and would get a job after AMC1. If you got an average CV, it is actually a question to your own self. If you got an average CV with with an internship and AMC1, then sky is the limit. You might be here stuck for years. And that is not for just Australia, it's for the UK as well. And that's why guys get disappointed when you don't get jobs after doing, oh, I've invested that much money and I'm not getting a job, or it's saturated. It is saturated for you, my friend. The pathway is saturated for you. There are still people getting jobs within month, within 3 months, within 6 months. Okay. But if you are going to think it's going to be an easy ride, please leave that concept. There is no such thing. If you're not able to get into a training scheme in Pakistan, trust me, getting into a training scheme in Australia is twice as hard, if not harder. Same goes for the UK. So leave that mindset that you're going to have a walk in the park landing into a training scheme in Australia. You need to decorate your CV, avoid gaps. There is no such thing as average days. It is only limited by your own credentials. सब कुछ होने के बावजूद भी लोगों के पास सीवी में अच्छी चीजें लिखी हुई नहीं होती, उनको सीवी बनाने नहीं आते. Sometimes people don't even know how to send an email. They put everything in a subject column. I've got 5 emails in the last week that there's written everything in the subject column. So you need to have a basic understanding and mannerism and discipline around it. And it's a hard talk that you must listen to at this stage in your career, rather than being disappointed कि एवरेज तो डॉक्टर रिजवान ने बोला था कि 6 महीने में जॉब मिल जाती, मुझे तो 1 साल हो गया. Are you an average person, or you're a talented and well-disciplined person? That is the question.
All right, sir. There is another question. I guess there is another pathway. Like, if you do post graduation from your home country and then you apply for a job in Australia, I guess it's competent pathway. So, like, if you could comment on that, because people are asking about it.
The competent pathway is from the competent pathways of other countries like US, UK, New Zealand, Canada. So if you've done PLAB and you have worked in the UK for 12 months, similarly, if you've done USMLE, you've done 2 years of residency in the US, similarly in Canada, then you can come through the competent authority pathway. If you've done FCPS training, which is at least 5 years plus, and passed the FCPS exam, then you can apply for a specialist training. Or a specialist comparability pathway, meaning that your FCPS training and your FCPS exam will get compared to the local Australian exam, fellowship exam, and fellowship training. And then you can apply for a specialist pathway. So that is the thing. And there's some other thing called short-term training pathway that you can come on a short-term training, but you need to be in the final 2 years of your fellowship training in a public hospital. And it's got a limit of 2 years that you can only be trained in Australia for 2 years, and then you have to go back. So the number of different pathways. In fact, there are quite a few pathways that you can to Australia, and you need to orient yourself about how it works into your own individual circumstances, because there is tremendous opportunity. Let me put it this way: tremendous opportunity for the right people. If you understand the game, it's a game. You play it right, you get your first job, that's the target. Everything from that point onwards is easy as. And the returns in terms of salary and work-life balance, trust me, it's huge compared to any other system. Not in the short term, but medium and long term as well.
All right. So, sir, there's another question. I've personally seen people, buying books of USMLE Step 1, First Aid, like studying First Aid as well for AMC 1, considering like it will help us, settle on our, it will help them to create basic concepts, okay? And on that, they can, build further concepts for AMC 1 in terms of surgery and medicine. So, would you recommend that studying Kaplan or doing FA or doing for UWorld वगैरह for AMC 1, or should we go for only those books like John Murtaugh and stuff?
Look, John Murtaugh is a reference book. If you can pass the exam at the end of the day, you have to go through the question. I always say before starting any exam preparation, open up a paper. There are many past papers and solve it based on your base level knowledge. If you're at least 40% hitting, then you're in a good starting place. That because it's all final year concepts, it's all final year subjects. So if you've done the final year well, if you know and understand the questions well, if you answer them well, and you hit 40% pass rate, which is not actually the pass rate, but you pass 40% at your base level from whatever the preparation that you've done through USMLE or PLAB or whatever, you're at a good starting point. So yes, that'd be fine. But at the end of the day, you have to reference certain things because there are lots of guidelines which is Australia related, and you need to have gone through those guidelines. So on top of your USMLE training, you may have to add up another month or so to get more ready for the AMC part 1. It is not unusual to have, we've got 2 doctors who have done USMLE and they've done AMC 1 as well. So they found it very easy. One of them actually is working with me as an advanced trainee in emergency medicine. So yes, it is very doable, and it's good to mix and match, not putting all your eggs in the same basket.
So, sir, there was this question that there's an IMG from Russia, and he didn't do any internship in Pakistan or India. So, can he directly apply for internship in Australia?
You can apply for internship in Australia.
And there's another question, like, what is the average time to get job after AMC 2?
I've just answered that question. There is no average time. If you're average, more than 12 months, if you're self-disciplined and good, then people get jobs. I had one doctor, in fact, she was working in a small private hospital in Karachi. She said within a month of passing the AMC 1 only, she had 3 shortlistings and got the job offer from all these 3 jobs. So you should be asking question, why did she get 3 shortlistings? It's because she was working in Karachi South City Hospital in ICU. It was because that was her 1 year of experience in ICU in South City Hospital in emergency. It was because she had also done some pediatric and gynae experience prior to that as an RMO. It was because that she done a good training and she practiced her interview like crazy. She did an interview session with me and I was just completely blown with her communication skills. Look, it is hard as it may sound. There is very little margin and rule for mediocre people. You will find that the people who excel are the people who are good at talking, who are good at presenting themselves, who are good at creating distinctions. Distinction meaning they're good at creating a difference in their personality. It is the personality after all. And I would say in AMC too, I have seen as well. I can see when they come to my course and I tell them that you will be the first one who will pass this exam. They're just so positive. They speak well, they're fluent, they have got a good aptitude of learning and positivity. So if you are amongst that, and it's not a hard thing, if you haven't got, like I used to be the biggest introvert of them all, but I had to learn these things the hard way. How to communicate, how to interact, how to be an extrovert. If you can do that in the first 3 years after your graduation, world is your oyster. If you can't, then you can keep on applying for jobs and keep on being disappointed.
All right, sir. So there is another question about like how friendly is OBS in gynae pathway, and along with that,
IMG friendly. There is no such thing as IMG friendly. IMG friendly is a misconception. If you've got a ONG friendly CV, then yes. By that, we mean that you may have done a look. The first job in Australia is never going to be your obstetrics jobs. It's completely wrong to conceptualize that. Unless and until you're working as a gynecology registrar, obviously you can apply for an SRMO role. That's a different thing. But if you're coming as a junior medical officer to train in ONG, then target your first job as a general medical officer resident. It's much easier. It's much simpler. You can be very generic in your CV and then focus on ONG. And I was talking to one of my consultants in Wollongong Hospital, and he said, Rizwan, we cannot get enough doctors in our ONG department. When I page the ONG registrar, they're always busy in theater or something doing in the ward. There's so much deficiency of ONG doctor. But again, the jobs are not going to be given just because of the fact they need doctors. They have to follow a certain stringent criteria. They have to still interview you. They have to still make sure that you have got the right credentials and aptitude to land yourself into that job.
all right. So there is an other question about research that like if we publish a research in a PMDC registered journal, like that's something national journal, right? So would that count in our CV or should we go for international journals only?
No, research experience is only there to create a diversity in your CV. Look, there would be CVs from a doctor when I have got a repository of thousands of CVs. Majority of them would be obviously MBBS done in, then more than 80% would have done, 90% would have done their house job. Another 70% would have done at least a year of resident medical officer. And then, on top of that, 3 or 4 CVs would be like they've done a research. Now, this is immediately weighting up. So if you've got AMC in all 10 of those CVs and just 3 of those CVs got some research experience and they're well written and they've got good clinical experience, automatically they're going to get shortlisted. It is not about publication of those research in international. It is about showing the process of research, how to get an ethics approval. What kind of study? Was it a prospective study? Was it a retrospective study? Was it a randomized control trial? Were you just collecting data? Anything which shows and puts it in a good light that I know and understand the process. That is all I'm asking. You're applying for a journal resident medical officer job. There's not a lot of expectation at this stage. As long as you can make your CV shine. So it does not really matter if you do your elective in, as I said, same goes for the elective or in a big private hospital or public hospital. It could be in a rural center. It's your reflection of those learnings. It's your reflection of what you learned from a research experience. That is what matters. And there was a very interesting question I saw, that if your research is published in a PMDC recognized Pakistani journal, then does it hold same value in your CV as an international journal? Yeah, of course. Like, I mean, it's the understanding of the process. And obviously, if you've got publishing in some good journal, that's fine. What should a fresh MBBS graduate do right after or during the house job before taking AMC1 to guarantee a job after AMC1? I think we've spent a good part of an hour talking about that. Do your house job, stay in your resident medical officer job in emergency medicine, acute medicine, internal medicine, develop your structured references, do publications, do training and teaching, and do courses in your country whilst you're applying for jobs. So your CV should have these at least 5 things: internship, resident medical officer position without any gaps. If you have got teaching experience, if you've done courses, and plus the last thing, if you've got publications, then that's all there is to it. You're applying for a general medical officer position. It's very generic and broad. Having these things gives you a very good starting off point. Is it good to write AMC1 and AMC2 right after internship without any clinical experience? Yes, you can write them. They're both based on, in fact, it says on the AMC website that subjects in AMC and the skills which are assessed through AMC are that of a final year medical student. Although I would argue that for AMC2, in fact, if you want a better chance of passing AMC2, you should be working as a resident. I would say so. But then again, I've seen people passing AMC2. I passed PLAB2 in my first attempt after just doing an internship and 3 months of RMOship. So I think you can do AMC2 as well if you, do that. There was one very interesting question that you are fresh graduates, ideal CV template. There's a video that I've done on my YouTube channel in which I've completely dissected the entire CV. So you can use that template. Right. Okay. As the AMC1 never expires, if I did research, ALS, BLS courses, teaching experience, etc., but as compared to me, one other person with 3 to 4 years clinical experience, he will be preferred over me for getting the job or getting the shortlisted. I don't think so. The CV, how it's presented, there's so many cogwheels when it comes to shortlisting. Sometimes I've seen people having a great CV, but they're not being shortlisted. And sometimes I've seen people who have just organized and reshuffled their CV. There's no algorithm to shortlist, unfortunately. And when I come, I've come and worked with some of the residents here in Australia who've been given a job and got pathetic CV, like pathetic skills, on-floor skills. And there's some people when I'm mentoring them one-on-one, they speak so eloquently, they're so switched on. So it is about creating the best opportunity for yourself. And that opportunity, obviously the AMC1 is given, the clinical experience is given, but then that opportunity needs to be also highlighted in your very good, well-written CV. So people will always take numbers from you if their CV is well written. They highlight their experience. In CV, every job you write down your description, what you learn from that job. There are selection criteria question. If you address them in a detail with an example, as I was making an example of journaling, they will get shortlisted. In fact, I remember that initially when I was in the UK and also in Australia, I used to say CCV, like, can you give us an example of teamwork and collaboration, clinical production? CCV. What do you mean CCV? This is a selection criteria question which is there to make the decision to shortlist you. Writing that in a brief, succinct way with a clinical example will get you shortlisting. That's why I was saying that selection criteria and CV should go through at least 5 drafts before you come into the job market. So it's not about, 4 years over 3 years. Someone who is able to spin off their clinical experience as a very polished one. You can have a brand new car, but if it's not kept well, nobody's going to ride in your car. But if you got a 1-year or 2-year-old car, which is very kept well, it's clean, it smells nice, it's got no noise, obviously everybody would want to sit in that car. It's just a very crude analogy, but I think it makes sense.
Yeah. Sir, a couple of questions, and after that we'll be ending our session. There was one question about the volunteering experience. Like, if you volunteer for social activities and stuff, does that count? Like, if you put it in our CV? like someone mentioned, I guess, pitfalls or stuff. And there's another question about the telemedicine. Like, if we, practice, like if we do a clinical practice in telemedicine department, so does that consider it is considered as a clinical gap, or like it's good to go, like it's the part of your experience?
So anything, when you're not working in a hospital, when you're not seeing patients, you are in a clinical gap. If you're volunteering, you can call it teaching, you can call it anything you like, but you're in a gap. There is, I've heard, when the shortlisting criteria were set out, can you please make sure that people who are getting shortlisted are at least, 12 months of RMO experience and currently working. That's it. Now you can have anything or everything, but if you're not currently working, despite your 4 international publications, ATLS from America, ALS from UK, doesn't matter. If you're not working, you're gone. So why disadvantage yourself with a clinical gap when you've got good credentials? Maintain good credentials. You have to prioritize your own priorities. I know this is a challenging situation for some of the girls who get married and they've got a lot of social pressure of not being able to work. At the end of the day, you're just creating life hard for you. What we've seen in COVID, honestly, this is, swear to God, this is the honest truth. During COVID, all of these girls in Australia were sitting at home being mums for 5+ years with career gaps. All of their husband lost their jobs. They had no jobs. Okay. Now, government needed doctors because there were no doctors coming from overseas. So they said, where can we find these doctors? And all these doctors who were sitting mums started to be put into, and that many doctors got a job entry. Now, I'm not saying that it'll take another pandemic to have someone sitting at home to come into the job sector, because obviously it's not going to be like that. You will be waiting for a pandemic for that to happen. But even with the social pressures, you have to find a way to be working even part-time, for God's sake. Have some heart. For me to shortlist you, I need to see that you're working. And so does everybody else. That's the only single assurance that the reference that is coming through is person who's actually there. There's not a lot we can rely on when shortlisting people. Which hospital you're working in, what kind of jobs are you doing, how you've addressed your clinical criteria question, and what is your reference saying something about you. Okay. So yeah, just think about it.
I'd say that the crux of our session is like, do not go for a clinical gap, because if you do, it's going to affect your CV. And anything like it doesn't matter more than your clinical experience as MO or stuff. So
Yeah.
that I actually would like to end our session, but before that, I'd like to invite the National President of Synch Pakistan, Suraksha Germany. Surakshapi, am I audible to you? Suraksha.
Okay, I think that's probably some sort of technical glitch. Your person is not here. But thank you for an opportunity. Look, if you've got any questions, you can send me an email, info@emergencyfocus.net. We've got a website, www.emergencyfocus.net. Please.
Am I audible?
Yes, you're audible.
Okay. So it was basically she was not allowing the participants to speak. Assalamu alaikum, Rizwan sir. Assalamu alaikum, everyone else. So first of all, I'm here to conclude this highly anticipated session on AMC pathways. I want to extend my heartfelt gratitude to Dr. Rizwan Qureshi.
Thank you very much.
So,
Thank you.
sir,
It was a pleasure and honor.
Yes, hearing you has been an absolute honor. Your clear and straightforward insights have been incredibly enlightening, especially when you compare and contrast the AMC pathways with UK and USMLE pathways. So, comprehensive overview of the AMC pathways has enlightened its unique challenges and opportunities compared to UK and USMLE. Also, we have had audiences not from Pakistan, we have an audience from India, from Russia, from Kenya, as well as Sri Lanka. So all because of you. Thank you so much, sir. And thank you so much, everyone else. Thank you so much for participating with great enthusiasm and engaging very well. And that's all. Thank you so
Okay.
much.
I would just like to make one statement that, look,
Sure.
thank you for the opportunity for this platform. You guys are doing a tremendous job for raising these awarenesses. I think these sessions are not often held in enough light or enough amount to have these indoctrinated throughout the mindset of junior doctors, because this is at your level of fourth year, final year, and house job level and junior doctors, that you need to understand that it's no longer about the exams. The international medical or postgraduate medical education is no longer about just passing the exam. It's about so much more. And how can you do some little steps, honestly, I'm asking, to avoid huge disappointment? Save a lot of money at the end. There are people who will, just, optimize their time. They will do the right things very economically, and trust me, will get the job. You don't even have to leave Pakistan or India from your country to have a job offer here in Australia. We've seen that times and times again. So please organize yourself. Make sure that first 3 years are super focused. At the end of the day, you yourself are responsible for your own good keeping and your mental well-being. Stay positive. If somebody's telling you, and this is not just for Australia, if somebody's telling you UK is saturated, USMLE, you won't get visa, it does not work this way. Life is so much more. None of this matters. You will get a job in the UK if you play the game right. You will get, matched in US residency program. Obviously, it might be hard, but if you're playing the game right. And same goes in Australia. There's no such destination is superior. Yes, right now the opportunities are good. The overall, life balance is better in Australia. The salary is better. The circumstances are good. And I think we should explore new countries. It's not just about Australia. There's quite a few colleagues of mine who are working in Singapore and Malaysia and Middle East people have gone through. So it's very individual at the end of the day. Don't just follow blindly people. Develop, understand, question everything, and never shy away from hard work. Hard work done at this level, trust me, will save you money, time, effort, and seal your future in a good specialty. Take care of yourself and each other. Goodbye.
Bye. Thank you so much. You have been the best speaker I've ever heard. Thank you so much.
Lastly, for the audience, like if there is any question that is unanswered, you can go to his YouTube channel. There are a lot of detailed videos on, stuff that how to ace AMC and how to prepare for that exam. Also, he has a website on the name of the Emergency Focus. You guys can visit that as well. With this, we'd like to end this session. Thank you so much, Surakshapi, for joining as well. And this is all from Synch Pakistan. Thank you so much, and Allah Hafiz.
Thank you so much, everyone. Allah Hafiz.